And still on the doctor strike, in what appears to be doublespeak, Government Spokesperson Dr. Isaac Mwaura now claims that the ongoing strike is all about politics, accusing medical practitioners of plotting to extend the strike in order to benefit from the crisis. This as Public Health and Professional Standards Principal Secretary Mary Muthoni called for reconciliation to end the stalemate, as Ayub Abdikadir now reports.
With mounting calls for the government and healthcare professionals to find common ground amid the deepening national healthcare crisis, the state has accused the striking doctors of sabotage, deliberately willing to delay the rollout of universal healthcare coverage.
That there may be a political motive in sabotaging the Social Health Act, sabotaging the universal health coverage. There's no way you can explain, because if we've already given 2.4 billion, there's money for postgraduate training. Counties are willing to handle their own issues. National government is willing to handle its own issues. In fact, these negotiations have been led by none other than the head of public service.
The biting strike has severely affected Kenyans seeking services across public healthcare centers. But the government is now accusing private healthcare givers of being behind the strike.
Of course, people are going to lose out when shift works, when SHA works, and so therefore then, especially the private medical healthcare. And some of this involves these doctors. Let's say the truth. Because they work in public and also have private clinics. That's the truth. They are there. So they are now diverting traffic to their private clinics. It helps them. The more the crisis persists, the better.
However, in a stark contrast to the position held by the government spokesperson, the Principal Secretary at the Ministry of Health for Public Health and Professional Standards has struck a conciliatory tone, seemingly seeking a way out of the crisis.
And if we can ride on that goodwill from the government, then we will be able to sort all the other issues, both short-term, long-term, medium-term, and even the perennial issues that have bedeviled the health sector.
On Wednesday, the Employment and Labour Relations Court ordered the government and the striking medical professionals to conclude their conciliation meeting in 2 weeks and file a memorandum of understanding within that period.
Human resources for health is a critical pillar in our health sector, and we cannot do without human resources for health.
The strike, which entered its 22nd day, has seen Kenyans seeking medical services turned away, some suffering from illnesses that require urgency and who lack the financial capacity to get medical attention in private healthcare centers. Ayub Abdikadir, Citizen TV.